Hello, welcome to Homosexuality Anxiety, a misunderstood form of OCD called HOCD. Before we get started, a little bit about myself. My name is Dr. Monica Williams. I'm an associate professor at the School of Psychology at the University of Ottawa, where I serve as the Canada Research Chair for Mental Health Disparities. I'm also the clinical director of the Behavioral Wellness Clinic, where the New England OCD Institute is housed in Tolland, Connecticut. I'm board certified in behavioral and cognitive psychology and licensed in Canada and the US. So now I'm going to talk a little bit about obsessive compulsive disorder just to give you a background. It's called OCD, and that means it has obsessions and compulsions. Obsessions are unwanted, recurrent, disturbing thoughts that the person cannot suppress and that cause overwhelming anxiety. Compulsions are repetitive, ritualized behaviors that the person feels driven to perform to decrease the anxiety of the obsessions. OCD is fairly common. About 1 in 50 people will have OCD or subclinical symptoms of OCD at some point in their lives. So the lifetime prevalence is estimated at about 1.6% in the general population. Now, although we often think of OCD as a funny or quirky disorder where people may line up their shoes by color or alphabetize the cans in their cupboard, it is actually a very serious illness. It causes severe distress, including anxiety, often depression, and even suicidal ideation. It's very disabling, getting in the way of all sorts of common everyday things, everything from work to relationships to child rearing and just general well-being. OCD has a number of symptom dimensions. We like to say there's basically 4 major categories of OCD symptoms, which include worries around harming, or in other words, causing harm accidentally by not being careful enough, contamination, which leads to washing and cleaning, symmetry, which may involve arranging and repeating, and something we call unacceptable or taboo thoughts. And these tend to be paired with what we'll call mental or more covert compulsions. And there are several kinds of unacceptable thoughts. We can put these in categories as well. These may include things like religious or blasphemous thoughts, such as fear of offending God, violent thoughts like pushing someone in front of a subway train, and sexual thoughts. And what we're talking about today falls under this category of sexual thoughts, or in this case, sexual obsessions. Now, sexual obsessions in OCD are quite common. About 25% of people with OCD have experienced sexual obsessions, either currently or in the past. And these rates may be higher. This is just based on reports from people who are in OCD treatment centers, but a lot of people don't share these things because they feel very self-conscious about it. And common types of sexual obsessions include themes like being unfaithful to one's partner, incest, pedophilia, unusual sexual behaviors, and those run the gamut, getting AIDS, profane thoughts that may combine religion and sex, and homosexuality, which is what we're talking about today. Now, it's really important to understand that in OCD, these sexual thoughts are not fantasies. Normal sexual fantasies are enjoyable and generally harmless, and they may consist of wishes or memories of past sexual experiences or things people want to do that they aren't going to do. Now, sexual ideation in OCD, on the other hand, is very unpleasant and distressing because the person with OCD doesn't want these thoughts and they don't want the thoughts to become true or be real in any way. And sexual obsessions in OCD, unlike fantasies, rarely produce sexual arousal. And in fact, in general, on average, they actually decrease sex drive. These obsessions result in guilt, shame, distress, and anxiety. Now, the topic of today's presentation is homosexuality anxiety, or uh, what we're going to call HOCD. As we move on, I'll explain that more. But it's important to note that homosexuality fears have been documented in people with schizophrenia, panic disorders, and other disorders in the literature. And when I first started doing this research, there were actually no studies specifically about homosexuality anxiety in OCD until I published the first paper on this in 2008. Now, the DSM-4 field data set, which was a big study that was done looking at people in OCD specialty clinics at several different sites, had actually identified that 12% of the people coming for treatment had current or past concerns around homosexuality based on the Y-box, which is a measure of OCD. It's considered a gold standard. And of those, 8% had present concerns and 4% had past concerns. So it is something that has been documented for quite some time that people have seen in the past, but until fairly recently, there hadn't really been much research on it. And so that's what we're talking about today, HOCD. I got interested in this when I started a website, an online forum for OCD about 20 years ago, actually. It was called Brain Physics. And I noticed there were a lot of people posting on the forum about their concerns or obsessions that they might be gay. And a lot of these people had been banished from other forums where they were told that this was not an acceptable topic of discussion. So they, I guess, flocked to the one place that they were allowed to be. And that's when I first saw this term HOCD. It evolved out of the online community. And it's used to refer to straight people with OCD who worry about being gay. Now, I don't really like this term because it's not very inclusive, because you actually can have people of any sexual orientation who have anxieties around being a different orientation. But for the purpose of this presentation, we're going to just be focused on HOCD, in other words, straight people who worry about being gay. And so what is HOCD? Well, it involves obsessions such as the fears, obsessive fears about becoming gay or lesbian, or maybe somebody worries that they actually have been gay or lesbian all along and they've just been in denial, or they're only coming to terms with it now. They may experience intrusive, unwanted mental images of same-sex sexual behaviors. They may have obsessive fears that others may believe that person is not straight. And there are compulsions that go along with this. It's usually a form of checking, often a form of mental checking, like checking one's body for signs or symptoms of sexual arousal around the right people or the wrong people. And no, you can't see this. I'm making air quotes with my fingers as I say right and wrong. More about that later. But as I said, this term evolved out of the online community. And I really tend not to use this anymore, but I'm using it today because I know a lot of people online are using this term HOCD, and I wanted you to be able to find my presentation. So here are some examples of HOCD. One example, for example, could be a person who's worried that they might be a lesbian, a heterosexual female health worker who finds that she has these obsessions that are triggered by contact with attractive female patients. Another example is a 20-year-old male who masturbates to images of men to see if he likes that better than images of women. So he's taking these extreme measures to check his sexual valence. Another example is a high school student who worries that others of the same sex might find her attractive, and she finds herself second-guessing looks that other people may be showing toward her, or whispers she might hear, wondering, is it because people think I'm gay? Now, it's very common that mental health professionals misdiagnose this form of OCD, and the research shows actually that it is very often misdiagnosed as a sexual identity crisis. But it's really important to understand that HOCD is not internalized homophobia, or what sometimes people call ego dystonic homophobia. What makes this a little tricky to diagnose, for one, has been the lack of conversation around this kind of OCD. And the other is that there have not really been clinical screening tools that were designed specifically to address homosexuality anxiety in OCD. For example, the Y box, which again is one of our gold standards for measuring OCD, only has one item on it about homosexuality fears. And so as a result, I had to develop my own test for this, which is called the SORT, which is now available and people can take it and clinicians can use it for screening. And that came out fairly recently, but until then, there just weren't a lot of tools. Another thing that you'll find, which can make it a little easier to diagnose this, is that most people with OCD have OC symptoms in other areas. So they may have also struggles with hand washing or even problems that might not be OCD but related to OCD, like hoarding or body dysmorphic disorder. And it can sometimes be tricky to diagnose this if the symptoms are limited only to obsessions around homosexuality. And I'm going to go through a few key differences between having OCD and having a sexual identity crisis as somebody who may actually have a same-sex orientation. So for OCD, the person feels more sexually aroused by people of the opposite sex, whereas in a sexual identity crisis, they feel more sexually aroused by people of the same sex. With OCD, the thoughts about engaging in same-sex relationships are unappealing, upsetting, distressing, whereas in a sexual identity crisis, the thoughts about engaging in same-sex relationships are arousing, and they might be upsetting for other reasons, such as social stigma, but the person would feel more sexually aroused. For OCD, the person feels more anxious about romantic relationships with people of the same sex. In a sexual identity crisis, the person feels excited about romantic relationships with people of the same sex. In OCD, most of the time people have actually already enjoyed sexual experiences or some kind of romantic experiences with a person of the opposite sex. And for someone with a sexual identity crisis, they've most enjoyed their romantic or sexual experiences with people of the same sex. In OCD, there may be worries about same-sex thoughts because the person doesn't want to feel like they have to give up being with people of the opposite sex. In a sexual identity crisis, they may have worries about same-sex thoughts mainly because of what others might think or religious concerns. In OCD, the person's not able to stop thinking about same-sex relationships and the thoughts are a severe distraction. With a sexual identity crisis, the person often thinks about same-sex relationships, but they're able to stop when they need to. For with OCD, the person feels more emotional intimacy with a partner of the opposite sex. And in a sexual identity crisis, the person feels more emotional intimacy with a partner of the same sex. With OCD, people worry that people of the same sex might be attracted to them, whereas people with a sexual identity crisis like it when people of the same sex are attracted to them. People with OCD may fantasize about physical relationships with the opposite sex, including in dreams, whereas someone with a sexual identity crisis will fantasize about physical relationships with people of the same sex, including in their dreams. And people with OCD are going to try to learn more about sexual identity issues to reassure themselves that they're not gay, whereas people with a sexual identity crisis may try to learn more about sexual identity issues to better understand themselves and others in the LGBT community. Now, I do have to say that these are sweeping generalizations, and of course, with any complicated subject like this, there are some nuances, but these are average differences, and I also recognize that some of the language that we use here may not be the most inclusive language. For example, when we talk about something like opposite sex, that kind of creates a false dichotomy between straight and gay, and we know that sexuality is actually a spectrum. Now, in terms of treating OCD, HOCD, sexual orientation themed OCD is very often misdiagnosed, as I mentioned before, and we have research studies that prove this. And as a result, people may get misdirected interventions. I'm thinking about a client specifically who was seeing a psychiatrist for the problem, and the psychiatrist kept suggesting that he just try being with a man just to see if he liked it. So he kept going to gay clubs and bars and trying to envision himself with other men there. And he was told that everyone is bisexual, so he should just give it a try. And eventually he decided to drink a lot to see if he would be able to stand being with a man. Unfortunately, in his drunken state, he was approached by somebody who was very predatory, who then had sex with him in their car. And as a result, he then was also now suffering the effects of having been raped and wondering what that meant, that he had had this sexual experience with a man. And his symptoms became worse, and he became suicidal and was suicidal for 5 months. Now, exposure and ritual or response prevention is the best treatment for any kind of OCD, but this kind of OCD responds very well to it. Although research does show that people with sexual obsessions may need a longer and more aggressive course of treatment, and so the person may be in therapy a bit longer than others with other kinds of OCD. Now, you may be seeing a therapist already for your OCD, and I'm guessing that you haven't gotten what you needed, or you probably wouldn't be watching this video. And here are some tips for therapists and also things to look for to see if your therapist is actually doing this right. First of all, the therapist should educate the patient about OCD and how obsessions are maintained. And we know that compulsions are actually the driving force behind obsessions. Don't focus on the possible meaning of obsessions. People with OCD spend way too much time ruminating and thinking about this, and they need to do less of this and not more of it. Although we do promote psychoeducation about sexual thoughts and sexual orientation. Therapists should not suggest that the patient is actually gay, unless it's part of an exposure, and you would explain to your client ahead of time that you're doing an exposure. You wouldn't just say, hey, I think you're gay. Now, I'm not going to go into more details about how the treatment works here, but let's suffice to say that understanding the specifics of a patient's fears is essential to devising the best exposure for that patient. Now, medications are a very popular first-line approach, mainly because they're a lot easier, really, than exposure therapy, which is challenging, I'm not going to lie. And medications can help alleviate some of the symptoms. They can take down the obsessions a notch, reduce some of the compulsions and some of the anxiety, and even some depression, because the kinds of medicines that are used for OCD are typically antidepressants like SSRIs. And so if you have a little depression, it will help with that too. Unfortunately, these medications all have sexual dysfunction as a side effect, and at least a third of patients with OCD report this, which may make people with HOCD even more panicked than they already tend to be. Also, most OCD patients experience only a 30% reduction in symptoms, which is enough to take a little bit of the edge off, but it's not enough to get your quality of life back, especially if your OCD is severe. So the medications are not a magic bullet. And generally, I would say it's better to try the therapy first before the medication. But most of the clients that I see, they've already gotten medication from their doctors, so they're already on it. And I don't like to change things when we're, starting treatment. But in summary, sexual obsessions are a common symptom of OCD. And HOCD is not to be confused with a sexual orientation crisis. They're two completely different things. Cognitive behavioral therapy and medication together have been considered the treatment of choice, but exposure and ritual prevention, which is a kind of cognitive behavioral therapy, without medication is actually equally effective as exposure therapy with medication. So the research shows that adding medication actually doesn't make the therapy any more effective because it is already so effective. If you're interested in getting treatment for HOCD or any kind of OCD, you can certainly contact our clinic for help. We do treat people nationally and internationally. We have a team of therapists. Many of them are online therapists, and you can get help online, or you can even come to our clinic for an intensive outpatient program that's 2 weeks long. Or you can visit the International OCD Foundation. They have a directory of OCD therapists as well. And you can learn more about OCD at our website, ocdtypes.com. And we have a book that actually just came out last year for therapists about sexual obsessions in OCD. And we talk a lot about HOCD in the book. And it just came out on audiobook too. So if someone wanted to listen to it on audio, they could. Honestly, not really sure why you'd want to listen, but you can. And for those of you who want to know where all this information came from, here is a list of scientific and clinical references. These are all from research studies that I've done. This is actually only a small subset. I actually do quite a lot of OCD research, and probably have done more research in this particular area than any other OCD researcher. So I've got a whole compendium of stuff that you can look up and read, and you're welcome to do so. And if you have any questions about anything that you've read, feel free to contact our clinic or reach out to me. I would love to talk to you about it if you'd like. And so that concludes our presentation. Thank you so much for listening.